He grabbed her wrist in front of everyone. Silas Moretti, the man who owned half of Chicago's shadow economy, who had 3 sitting judges in his pocket and 2 aldermen on his payroll, reached across his own desk and closed his fingers around the wrist of a woman who had just spent 6 hours saving one of his men's lives. He didn't raise his voice. He didn't need to. The room went silent the way rooms go silent when the temperature drops 10 degrees in a single second, and every man standing along the walls found something intensely interesting to stare at on the floor. "Say that again," he said quietly, in English this time. Ilara Voss did not look away. That was the moment. Not the gunshot at 3:00 a.m., not the blood on the operating table, not the money. This was the moment that changed everything. The second she held eye contact with the most dangerous man in Chicago and refused to flinch, even as her pulse hammered so hard she could feel it in her teeth. If you were standing in that room, what would you have done? Before we go any further, if stories like this one keep you up at night, if you've ever rooted for someone the world wrote off, subscribe to this channel right now and hit that bell so you never miss what comes next. Drop a like on this video and leave a comment below telling me what city or country you're watching from. I want to see exactly how far this story travels. Now let's go back to where it all began. The alarm on Ilara's phone went off at 2:47 a.m., but she was already awake. She'd been awake for the better part of an hour, lying on the narrow cot in the back room of her basement clinic, staring at the water stain on the concrete ceiling that had been spreading slowly since October. She had a system for insomnia. She counted the things she needed and couldn't afford. Suture thread, size 3 to ketamine for anesthesia top-ups, a replacement laryngoscope blade, fresh sterile drapes. The list was long enough to keep her mind busy until exhaustion finally pulled her under, and most nights it worked. Tonight it wasn't working. She sat up, pushed her feet into the pair of worn clogs she kept beside the cot, and walked through the curtained doorway into the operating space. It wasn't much to look at. 2 surgical lights she'd salvaged from a decommissioned clinic in Evanston, mounted to a ceiling frame she'd bolted up herself. A stainless steel table, second-hand but solid. Instrument trays bolted to rolling stands. An autoclave the size of a mini-fridge that she'd paid for in cash from a dental supplier who didn't ask questions. The walls were exposed brick and painted over pipes, and the whole space smelled faintly of bleach and machine oil. She stood in the middle of it and breathed in. There was something clarifying about the quiet down here. 4 flights below street level in a building that had been a meatpacking operation in the 1940s, the city noise didn't reach her. The rumble of the L train, the sirens, the drunk arguments that spilled out of the bars on Halsted at closing time, all of it got swallowed somewhere in the concrete and steel between her and the surface. Down here, there was only what she could control. Down here, she was still a surgeon. She was checking the expiration date on a bag of normal saline when the buzzer went off. Not the gentle chime she'd rigged to her phone when a patient texted for an appointment. The iron buzzer at the alley door, the one she only gave to people she trusted, and she only trusted 4 people on Earth. It went off once, hard, like someone had hit it with their fist rather than pressed it. She crossed to the security monitor mounted beside the supply cabinet. The feed was grainy, black and white, the timestamp flickering in the upper corner. The alley light was on. Ronan Vale filled most of the frame. She had treated Ronan twice. She knew how big he was, 6'3", built like someone had taken a boxer and scaled him up by 20%. And she had learned not to be rattled by him. But what rattled her now was what he was carrying. A young man draped across his arms like something boneless, head hanging back, one arm dangling. Even in the low-resolution feed, she could see the dark stain spreading across the kid's shirt. She hit the release for the alley door and was already moving toward the instrument tray. By the time Ronan came through the inner door, she had gloves on and the overhead lights at full. "Table," she said. "Set him down flat." "What happened?" "GSW, right side, entrance wound just below the ribs, exit wound in the back." Ronan's voice was controlled, but his jaw was set, and his eyes hadn't left the kid since he walked through the door. "It happened 40 minutes ago. We drove around before we came here." "Why did you drive around?" "Because we weren't sure we weren't followed." Ilara had the kid's shirt cut open before Ronan finished the sentence. The entrance wound was roughly where Ronan had described, below the right rib cage, about 2 inches lateral to the midline. The exit wound in the back was slightly higher and to the left. She pressed her fingers around the entrance and the kid groaned, his head rolling sideways. "He's conscious," she said. "What's his name?" "Nico. Nico." She said it clearly, close to his face. "I'm a doctor. You're going to be okay. I need you to stay still." She looked up at Ronan. "How old is he?" Ronan didn't answer immediately. "Ronan, how old?" 19. She absorbed that and said nothing. She fitted the pulse oximeter clip to Nico's finger and the reading came back at 91. Low. She got an IV line into his arm on the first try, taped it down, and started a saline drip. She pulled the portable ultrasound unit off its shelf. It was old, the screen worn at the corners, but it worked, and ran the probe across his abdomen. What she saw made her stomach tighten. "There's blood in the cavity," she said. "Not catastrophic yet, but it's accumulating. The bullet may have nicked the liver." She stood back and looked at Ronan. "I need to open him up. I can stabilize him here, but I want to be clear with you. If there's significant hepatic damage, and I can't control the bleeding with what I have, I can't save him. Do you understand that?" Ronan looked at her for a moment that felt longer than it was. "Do what you can. I always do." She worked for 4 hours. There was a moment around the 90-minute mark when Nico's pressure dropped, and the monitor started screaming, and Alara's hands moved faster than she consciously directed them, the way they did in residency when the adrenaline took over and training became reflex. The liver laceration was a grade 2, manageable, with the right suture technique, but it required patience she didn't entirely have because his pressure kept wanting to drop and she kept having to correct it. She used almost her entire stock of packed red blood cells, which she'd been hoarding in the small pharmaceutical refrigerator for 3 months against exactly this kind of emergency. When she finally closed, her back ached in a way that went down to the bone, and her hands were shaking slightly from the sustained tension of holding them steady for so long. She stripped off her gloves and leaned against the wall and let herself breathe for 30 seconds. Ronan was still there, standing in the corner exactly where he'd been for 4 hours. She'd forgotten about him. She sometimes forgot about everyone in the room except her patient and her hands. "He's stable," she said. "The liver is repaired. He lost a significant amount of blood, and I've given him what I have, but his pressure is holding now." Ronan looked at the table. Nico's chest rose and fell in a slow, even rhythm. "You'll want to thank whoever trained you," Ronan said. "His name was Dr. Samuel Park, and he's dead," she said. "So I'll pass." She pushed off the wall. "Nico needs to stay here for at least 72 hours, ideally longer. I need to monitor him for infection, for any internal bleeding I might have missed, and for... That's a problem." "I understand it's a problem. It's still what needs to happen." Ronan nodded slowly, in the way men like Ronan nodded when they were accepting something they didn't like because they didn't have another option. "I'll need to tell Mr. Moretti." "Tell him whatever you need to tell him," Alara said. "Just make sure I get paid, the full amount this time." Ronan looked at her and something shifted slightly in his expression. Not pity, something closer to respect. "Yeah," he said. "I'll make sure." She didn't get paid the full amount. 3 days later, when she had finally confirmed that Nico's fever had broken and the infection she'd been watching for had not materialized and the boy was going to live, she made the trip to the nightclub on West Fulton where Ronan had told her she could collect her fee. She'd been to Moretti's places twice before, always through side entrances, always to collect payment that she never received directly from Silas himself. This time was supposed to be the same. She was supposed to give her name to the man at the service door, wait in a back hallway, and receive an envelope from someone she'd never met. Instead, she waited for 45 minutes and received an envelope that was $12,000 short. She stood in the hallway and counted it twice. Then she folded it, put it in her jacket pocket, and walked through the door that led to the main floor of the club. She knew it was a mistake as she was doing it. The club was already crowded for a Thursday evening, the kind of crowd that spent money on premium bottles and didn't look too closely at who else was in the room. She moved through it toward the far end of the bar, where one of Ronan's men spotted her immediately and stepped into her path. "You need to go back to the... Tell him I want to speak to him," she said. The man blinked. "Tell who?" "The person who just paid me $12,000 less than I'm owed." She held the man's gaze. "I think you know who I mean." She was escorted, not gently, to a table near the rear of the room that had a clear sight line to every entrance. Silas Moretti was sitting there with two men she didn't recognize and a glass of something she couldn't identify. He looked at her as she approached with an expression that suggested he was calculating something. He was not what she expected. She had expected someone physically imposing, someone whose appearance communicated threat. Instead, Silas Moretti was lean and quiet-looking, maybe 42, 43, dressed in dark clothing without any of the obvious jewelry she associated with men in his position. He had the kind of stillness that didn't read as calm. It read as someone who had learned that making sudden movements was usually unnecessary. "Dr. Voss," he said, "sit down." "I'd rather stand." "I'd rather you sat." She sat. Not because of the way he said it, because she was tired and her feet hurt, and there was no strategic value in being contrarian about furniture. "You're $12,000 short," she said. Silas looked at the two men across from him, who took that as a signal to excuse themselves. When they were gone, he looked back at her. "The surgery took 4 hours," he said. "My standard rate for emergency trauma surgery is 4 hours. Your people quoted me $20,000 when they brought him in. That was before my people understood the extent of the surgery. Nico's recovery was complicated, the extended monitoring. I saved his life," she said flatly. "I spent 4 hours with my hands in a 19-year-old boy's abdominal cavity, using my own supplies, my own equipment, and my own blood products. In a clinic I built myself with no institutional support. I was quoted $20,000. You sent me 8. Silas looked at her for a moment. "You were compensated fairly for the—" "Don't," she said it quietly. "Don't tell me I was compensated fairly. You know I wasn't." Silence. The music from the main floor was a low throb through the walls, and the noise of the crowd was a distant wash. And in the gap between all of it, Silas Moretti studied her face the way someone studies a document they're not sure they've read correctly. Then she made her mistake. She was exhausted and underpaid, and she had been awake for most of the previous 3 days, and the words came out of her mouth in her grandfather's language before she could catch them. A short, blunt phrase that in the dialect he'd spoken meant something roughly equivalent to "you calculating, small-souled man." She said it under her breath, but not quietly enough. Silas went very still. "Say that again," he said, in English this time. She met his eyes. Her pulse did something uncomfortable, but she kept her face level. "I said you're being unfair." He stood up slowly. He was taller than he looked sitting down. He moved around the table with the kind of deliberate pace that communicated he was not in a hurry, he was never in a hurry, because the world had learned to wait for him, and he came to stand in front of her and reached out and closed his fingers around her wrist. Not hard enough to hurt, just enough to make escape a deliberate choice. "Come with me," he said. Every instinct told her to pull free and walk out of the building. She could feel the eyes of the men along the walls, could feel the music still going, could feel the warmth of Silas Moretti's hand on her wrist, and the calculation in his eyes. She went with him. His office was through a door behind the bar, down a short corridor, and it was nothing like the club. No ambient lighting, no sleek surfaces, just a large wooden desk with actual papers on it, shelves with actual books, a small bar cart with a limited selection of bottles, and a window that looked out onto an air shaft. He sat on the edge of the desk and gestured at the single chair in front of it. Alara stood. "You're going to stand," he said. It was not a question. "I'm going to stand." He made a small sound that might have been amusement. "What language was that?" "What you said." "My grandfather's. He was from a fishing village in Galicia. I learned his language before I learned English." "What did you say?" She held his eyes. "That you have a small soul." The words sat in the air between them. She fully expected the temperature of the room to drop another 10 degrees. Instead, Silas reached behind him, picked up an envelope from the desk, and held it out to her. She took it. It was thick. $20,000, he said, as quoted, plus a $4,000 adjustment for your extended monitoring services. She stared at the envelope in her hand. "Open it if you want," he said. She didn't. She knew somehow that if he was lying to her, she'd rather not find out in this room. "Why?" she said. He tilted his head slightly. "Because you're right that I underpaid you." "You didn't adjust the rate out of fairness," she said. "You don't operate on fairness. What did you actually want?" He looked at her for a moment with that same calculating quality, and then he said, "I want to offer you a contract." She didn't say anything. "Exclusive," he continued, You would be retained as the private trauma surgeon for my organization. Any of my people who need treatment come to you. You're compensated quarterly regardless of volume, plus bonuses for complex cases. You'd have a budget for supplies, access to certain resources through my network that your current setup doesn't have. You want to own a doctor, she said. I want to retain one, he said. There's a difference. There isn't. His expression shifted, just slightly. You currently operate out of a basement clinic with equipment that's mostly obsolete. You treat my people, and before me you treated 3 other organizations in this city, 2 of which have since folded. You are one bad outcome away from having no income at all and no way to pay for that clinic, which I'm guessing is also where you live. He paused. Did I miss anything? She hated how accurate it was. The equipment isn't mostly obsolete. The suction unit you used during Nico's surgery is from 2009. She blinked. How do you know what suction unit I used? Ronan described your setup. He's observant. Silas folded his arms. My offer is $20,000 monthly, plus supply budget, plus emergency bonuses. That is more than most attending physicians make in a hospital system. Her throat was dry. She thought about the saline bags she'd been rationing, the suture thread she'd been buying in small quantities because she couldn't afford a full stock, the cot in the back room. I don't belong to anyone, she said. No one's asking you to belong. His voice was measured. I'm asking you to work. She looked at the envelope in her hand. $24,000. She had $643 in her checking account. She made herself breathe slowly. If I agree, she said, I have full clinical authority. You do not tell me who gets treated first. You do not override my medical decisions. You do not send me patients without appropriate notice unless it's a genuine emergency. Agreed. I will not perform procedures that are used to inflict harm. If someone comes to me with injuries that suggest I'd be patching them up to send them back to hurt someone, that's not what I need from you, he said. I'm stating it anyway. He nodded. It was a measured nod. She could not tell if it was honest. I want a month, she said. I'm not signing anything permanent. A month. We see if this arrangement is workable. Silas Moretti looked at her for a long moment, in the way he had of looking at things, like he was reading something that required patience, like he was checking his calculations. 1 month, he said. Yes. She drove home at midnight with $24,000 in an envelope on the passenger seat and a feeling in her chest that she could not name. It wasn't relief. It was something thicker and more complicated than that. Something that felt uncomfortably close to having just signed a document she hadn't fully read. Her phone rang as she was pulling into the alley behind the building. Unknown number. She let it ring. Inside the clinic, Nico was asleep on the recovery cot, his breathing slow and even in the darkness. She checked his IV line, checked his dressing, checked the monitor readout on the small portable unit she kept clipped to the cot frame. He was going to be fine. She looked at him for a moment. 19 years old, someone's son, lying in a basement under the city with a liver that she'd stitched back together with whatever she had on hand. And she made herself acknowledge the truth she'd been avoiding for the past hour. She hadn't said yes because of the money. She'd said yes because Silas Moretti was the first person in 4 years who had looked at what she'd built down here, this impossible, inadequate, stubbornly functional thing, and recognized that it had value. She hated that it mattered. She sat down in the chair beside the monitor and pulled her knees up and stared at the ceiling and thought about her grandfather, who had fished the same water his grandfather fished and never once asked anyone for permission to keep doing it. You have a small soul, she had said to Silas Moretti. She was no longer sure that was true. She was no longer sure about a lot of things. Above her, 4 flights up, Chicago moved through another cold midnight, oblivious and massive, full of people making deals in the dark and calling it survival. She had spent 4 years telling herself she was different from all of it, that she was down here for the right reasons, that the reasons kept her clean. Now she had $24,000 in an envelope and a contract with a man who ran his empire on controlled violence, and the reasons felt considerably less clear than they had this morning. Nico shifted on the cot and mumbled something in his sleep. She watched him breathe. She thought, just 1 month. She thought, you know that's not true. The iron buzzer at the alley door went off, and for 1 sharp second she stopped breathing entirely. Then she looked at the security monitor and saw Ronan standing in the alley, his breath misting in the cold, holding a paper bag that was probably food because she hadn't eaten since noon, and apparently someone had noticed. She buzzed him in. And that was how it started. Not with a signature, not with a handshake, not with any of the formal markers of commitment. It started with a buzzer in the dark and a paper bag of food and the quiet acknowledgement that she had already crossed a line she could not now uncross. She was no longer the ghost surgeon hiding beneath Chicago. She was Silas Moretti's doctor. And somewhere in the back of her mind, in the part she'd learned to distrust, something that had been very tightly coiled for a very long time was beginning, slowly, to uncurl. Ronan set the paper bag on the instrument tray and didn't apologize for showing up unannounced, which Alara was starting to understand was simply how he operated. He pulled out a container of soup, a wrapped sandwich, and a bottle of water, and arranged them on the only clean surface available with the same methodical precision he probably used when he arranged everything else in his life. "You haven't eaten," he said. "You've been watching my clinic?" "Someone has." He said it without embarrassment. "Mr. Moretti asked me to make sure you were covered while Nico's still in recovery." She looked at the soup. She was hungry enough that her hands felt slightly weak. "Tell Mr. Moretti I don't need a babysitter." "I'll tell him you said thank you." She ate standing up because sitting down felt like conceding something. Ronan stayed near the door with his arms at his sides and his eyes moving around the space in the systematic way of someone cataloging exits. He looked at the autoclave. He looked at the instrument trays. He looked at the surgical lights and the blood pressure monitor and the $2,000 portable ultrasound unit that she'd bought used from a veterinary clinic in Wisconsin. "This is all you have?" he asked. "It's functional." "I didn't say it wasn't." She lowered the soup container. "Ronan, why are you actually here?" He looked at her without any adjustment in his expression, which was how she was learning to read him. The things Ronan Vale left out of his face were usually more informative than the things he put in. "Mr. Moretti wants to meet with you tomorrow. Not here. At the penthouse." "I was under the impression my clinic was the meeting point." "He wants to see where he's putting his money. Give you a full supply rundown. Set a budget." Ronan paused. "He also wants to talk about what happened tonight." She felt something shift in the room. "What happened tonight?" "The underpayment. The conversation in his office." Ronan's tone was neutral, factual, like someone reading aloud from a report. "You said something to him in another language. He wants to understand the context." Alara set down the soup container on the tray and wiped her hands on a cloth. "The context is that he paid me $8,000 for a procedure that cost me considerably more in materials alone, and I was tired, and I said something I shouldn't have said in a way I shouldn't have said it." Ronan nodded. "He knows that." "Then what does he want to discuss?" "I think," Ronan said, choosing his words with the care of a man who has learned that precision matters. "He wants to understand what kind of person you are." "He already hired me." "He hired you because he needed a surgeon. Now he wants to understand who he hired." She looked at Ronan for a moment. He was not threatening her. He was not performing menace the way some of the other men she'd dealt with in the past 4 years had performed it. I was simply informing her of a fact. Silas Moretti was paying attention to her, and being paid attention to by Silas Moretti was a thing that required her own attention in return. "Fine," she said. "What time?" 11 in the morning. "Nico can't be moved. He stays here. One of my people will sit outside your door." She almost argued. Then she looked at Nico's sleeping face, at the IV line, at the monitor, and thought about what she would do if someone came through the alley door at 4 in the morning without the right buzzer code. She thought about the $12,000 gap in the envelope and what it suggested about the kind of men who circled Silas Moretti's world. "Your man stays outside," she said. "He doesn't come in unless I say so." Agreed. Ronan left. The man he posted outside was someone she'd seen before, thick-shouldered, young, with the flat effect of someone who'd learned to keep his reactions internal. He nodded at her when she cracked the alley door to check that he was there, and she nodded back, and that was the entirety of their relationship. She slept 3 hours on the cot, which was 3 more than she expected. The penthouse occupied the top 2 floors of a building in the West Loop that looked, from the outside, like the kind of place that housed financial firms and architecture studios. The lobby had actual art on the walls, not prints, originals, and a security desk staffed by 2 men who wore suits that fit well enough to obscure what was underneath them. Ronan met her at the elevator. He's on the upper level, Ronan said. He's been up since 5. Does he sleep? Not much. The elevator opened into a wide space that felt nothing like what she'd expected. She had imagined something that announced itself. Dark wood, heavy drapes, the aesthetic of money performing its own importance. Instead, the penthouse was spare and bright, with floor-to-ceiling windows on 3 sides, and furniture that was expensive without being ornate. Books on actual shelves, papers on an actual table, a kitchen that looked like it was used. Silas was standing at the kitchen counter with a cup of coffee when they came in. He was dressed simply, dark trousers, a gray shirt with the sleeves rolled to the elbows. He looked up, and whatever he was thinking when he looked at her, he kept it entirely behind his eyes. Dr. Voss. He gestured at the kitchen table. Sit down. Coffee? Please? He poured it himself, which she hadn't expected. He set it in front of her and sat across from her and looked at the table between them for a moment before he looked at her. Ronan tells me Nico is improving. He's improving, she said. He's not out of the woods. I need to watch his liver function for at least another week. If the repair holds, he has a full recovery ahead of him. If it doesn't, she stopped. I believe it will hold. Silas nodded. He wrapped both hands around his coffee cup and looked at her with that measuring quality she was already beginning to recognize. How did you end up in that basement? She had known the question was coming, in some form, and she had decided on the drive over that she would answer it honestly, because dishonesty in this context felt both pointless and dangerous. I was a trauma surgeon at Northwestern Memorial, she said. Attending physician, 4 years out of residency, track record that was sufficient, meaning excellent, meaning I was good at my job and I knew it, and I didn't go out of my way to hide that, which made me some enemies in administration that I didn't take seriously enough. She drank her coffee. It was better coffee than she'd had in months. 3 years ago, we had a patient, 17-year-old kid, uninsured, came in through the ER after a motorcycle accident. Significant internal trauma. The administration initiated a transfer protocol, which is what you do with patients who can't pay when a receiving facility has agreed to take them. He was being transferred. He was dying, she said. He was being transferred because he was dying, and dying is expensive, and there was a hospital in Indiana that had agreed to take him, and by the time he got there, he would have been dead, and the liability would have belonged to Indiana. She set down her cup. I blocked the transfer. I took him into surgery without administrative approval. He survived, and they fired you. They suspended me first. Then there was an investigation. Then they found 3 instances of protocol deviation over the previous 18 months. Small things, the kind of thing every surgeon does when the rule doesn't fit the situation. And they used those to build a case for termination. Silas was quiet for a moment. You could have fought it. I did fight it. For 8 months. I spent the money I had on a lawyer who was very confident and very expensive and ultimately insufficient. She looked out at the windows, at the gray Chicago morning pressing against the glass. After the license was suspended, I had the choice of relocating and starting over under someone else's supervision, or doing what I knew how to do in the only place that would let me do it. She looked back at him. The basement was already there. The building belongs to a man who owes my grandfather a favor that my grandfather never collected. He let me have the space. Silas said, Your grandfather. He's been dead for 6 years. But the debt apparently persists. Something moved across Silas Moretti's face. It wasn't pity. It was something more complicated. The expression of someone recognizing a pattern they hadn't anticipated finding. You violated the rule to save the patient, he said. Yes. And the rule destroyed your career for it. Correct. And you built something outside the rule because the rule stopped being useful to you. She looked at him. I'm not like you, she said. If that's the parallel you're drawing. I'm not drawing anything. He leaned back slightly. I'm observing. The morning moved around them. Somewhere below, the city was doing what it did, producing noise and weather and the low, constant friction of millions of people wanting different things. Up here, there was coffee, going cold, and 2 people sitting across a table from each other, both of them outside the systems that had formed them, both of them too stubborn to pretend otherwise. Supply budget, Ilara said. You said you wanted to go through that. I do. He pulled a notepad across the table. Tell me what you need. She told him. She had written the list at 5 in the morning on the back of a prescription pad. Suture materials, anesthetic agents, blood products, sterile equipment, monitoring supplies, a replacement laryngoscope, a current generation portable ventilator. She read it without apology or softening and watched him write it down, item by item, without flinching at any of it. When she finished, he said, "The blood products will take 2 days. I have a source, but it requires handling. Everything else can be there by tomorrow afternoon." She stared at him. "How?" "Don't ask about the supply chain. That's not reassuring." "It's functional," he said, and she recognized her own word from the night before, delivered back to her with the faintest trace of something she was not ready to call humor. She spent 2 hours in the penthouse, going through logistics and setting parameters. Ronan joined them for the operational part of the conversation, sitting at the far end of the table with a tablet and a level of organizational precision she hadn't expected from a man his size. By the time she left, she had a budget she hadn't imagined possible, and the beginning of a supply chain that would have taken her years to establish on her own. She drove back to the clinic with a headache she couldn't place, and the persistent feeling of having agreed to something that was still unfolding around her in ways she couldn't yet see. The infection showed up on day 6. Nico spiked a fever at 2 in the afternoon. Low grade at first, 101, the kind that could still go either way. By 8 in the evening, it was 103.4, and he was shaking despite 2 blankets, and Alara was sitting beside him with a very specific and very uncomfortable understanding of her own limitations. She needed a specific antibiotic, piperacillin tazobactam, IV formulation. She did not have it. She had never been able to stock it because its shelf life in stored conditions required refrigeration infrastructure she didn't have, and its procurement through her usual channels required a DEA license she no longer possessed. She called Ronan at 8:15. "I need a medication I don't have. Nico's infected and it's moving fast." "What medication?" she told him. She heard Ronan's breathing change, just slightly. Not panic, something more controlled than that, but she could hear the weight of the problem landing. "How long does he have?" Ronan asked. "If this is what I think it is, untreated, he gets worse through the night. By morning we're looking at sepsis. After that—" She stopped. "Get me the medication. I'll call Mr. Moretti." "I don't care who you call. Get me the medication." She hung up and went back to Nico. He was conscious, intermittently, surfacing from the fever to look at her with eyes that were too bright and too confused, and then sinking back into the restless half-sleep of someone whose body was fighting something it wasn't winning against. She kept cooling cloths on his forehead, kept checking his pressure, kept the IV fluids running, and his electrolytes as balanced as she could manage with what she had. She was checking his temperature for the 3rd time in 40 minutes when she heard the alley buzzer. She looked at the monitor. It was Silas. Not Ronan. Not one of Ronan's men. Silas Moretti, standing in the alley in the dark in a coat she'd never seen him wear, holding something in both arms that resolved, as she watched the monitor, into a sealed pharmaceutical transport bag, the kind that maintained temperature integrity. She buzzed him in. He came through the door and handed her the bag before he said a single word. She unzipped it with her teeth because her hands were already moving into exam gloves, and inside were 2 labeled IV bags of piperacillin tazobactam, properly sealed, with lot numbers and an unbroken cold chain. "Where did you get these?" she said. "Does it matter right now?" She looked at him for 1 second. Then she turned to Nico and started preparing the line. Silas stood in the corner and watched her work with the same stillness Ronan had, but different in quality. Ronan watched as a tactician, cataloging threats. Silas watched the way someone watches a thing they recognize as valuable without being entirely sure what category of value it belongs to. She was aware of him the way she was aware of peripheral noise, registered, filed, not acted on. She got the antibiotic running and checked Nico's pressure and smoothed the blanket and told the kid, who may or may not have heard her, that he was going to be fine. Then she stood up and turned to face Silas. "How did you get pharmaceutical-grade IV antibiotics in 3 hours?" she said. "And don't tell me not to ask." He looked at her. "There's a pharmacist in Oak who I've helped through some difficulties. He has hospital purchasing access. That's procurement fraud. I'm aware." "Could have just told me that." "You told me not to tell you not to ask." She absorbed this. "The pharmacist? Is he going to be in trouble for this?" "No." "You're certain?" "I protect people who help me," he said. It was very quiet and very even. and she understood that it was not an abstraction. It was the most specific thing he had said to her so far. The night deepened around them, and Nico's fever broke at just past midnight. Slowly, the way fevers break when the medication is winning, his temperature sliding down through 102, then 101, then settling into something that stopped being an emergency and started being a recovery. Elara sat beside the monitor and felt the particular exhaustion of sustained vigilance finally releasing its grip on her muscles. Silas had not left. He was in the chair near the door, elbows on his knees, a cup of coffee she'd made him going cold on the floor beside him. He was looking at Nico's face. "He's going to be fine," she said. "You said that earlier." "Now I'm certain." Silas looked at her. His face in the low light was stripped of the careful neutrality he wore in the penthouse. Not because he'd made a decision to let it go, but because exhaustion had simply eroded it. He looked like someone who had spent a very long time being careful and had not entirely decided if it was worth continuing. "Why did he end up in your clinic?" she said. "Nico, he's 19. How does someone that age end up—" "He was 16 when I met him," Silas said, "living in a car in Pilsen. He'd aged out of the foster system and had nowhere to go and was making money the way people make money when they have no other options." He paused. "I gave him a job. He's been with us for 3 years. She looked at him. "He's a child." "He was a child. He's not anymore." Silas's jaw tightened almost imperceptibly. "And I would prefer he stayed alive long enough to have the option of being something else." She wanted to say, "That's not how it works in your world." She wanted to say, "You keep them close until they're useful, and then what?" But she looked at Nico's face, the kid's actual face, smooth and young even in sleep. And she thought about the 4 hours she'd spent with her hands in his body keeping him alive. And she thought about Silas standing in the alley at midnight with pharmaceutical supplies he'd procured through channels she didn't want to examine, and the judgment she'd been preparing dissolved into something less certain. She did not say any of it. "Get some sleep," she said instead. "There's a cot in the back room if you want it." He looked at her with an expression that suggested this was not a thing he did. Sleep in other people's spaces, accept the hospitality of people he'd employed 3 days ago. "I'll stay in the chair," he said. "That's going to be terrible for your back." "I've survived worse." She almost smiled. She caught it before it fully formed, which felt important, though she couldn't have articulated exactly why. Well, the second week was different. Not dramatically, not with any single scene she could point to as the moment of change. It was more like a gradual pressure shift, the kind you feel in your ears before weather moves in, the kind that tells you the atmosphere around you has altered in ways that aren't yet visible. The supplies arrived as Silas had promised, and for the first time since she'd opened the basement clinic, Elara worked with what she actually needed rather than what she could cobble together. The new laryngoscope sat in its sterile packaging on the instrument tray, and she kept catching herself looking at it the way she used to look at new equipment in the hospital, with something close to pleasure that she was embarrassed to feel. Ronan's man outside the door became, over the course of the week, a fixture she'd stopped registering, the way you stop registering the hum of a refrigerator. His name was Cal. He was 25 from the South Side, and he'd joined Moretti's organization at 22 after 2 years of a construction job that paid badly and ended worse. He told her this in pieces over the course of several evenings, not because he was a talker, but because she kept asking questions, and she kept asking questions because she was a surgeon, and surgeons are trained to understand the complete context of the body they're treating, and the bodies she was treating were not separate from the world that had produced them. Silas came to the clinic 3 times that week. Never announced, never staying long. He came to check on Nico, which he would not have said aloud, but the pretexts he used, operational updates, supply chain questions, a brief about the security protocol for the alley, were thin enough that she stopped pretending she didn't see through them. He would stay 20 minutes, sometimes 30. He would stand near Nico's cot for a few of those minutes in a way that communicated something she didn't have a clinical term for. On the 4th visit, she said, "You could just come and check on him. You don't need a reason." Silas looked at her from across the room. "I always have a reason." "Then you're working very hard to pretend your reason isn't that you're worried about a 19-year-old kid who works for you." A pause. Something shifted in his expression, not anger, not even discomfort, but the very slight adjustment of someone who has been accurately identified and is deciding how to respond to that. "He reminds me of someone," Silas said. She waited. He did not elaborate, She did not push. That was the first thing she learned about navigating Silas Moretti. The information he chose not to give you was almost always more important than the information he gave, and pressing for it before he was ready produced nothing except a door closing somewhere that might otherwise have stayed open. Nico began improving rapidly after the infection cleared. On day 9, he was sitting up and eating actual food, badly, enthusiastically, the way 19-year-olds eat when they've been living on IV nutrition. And on day 10, he asked Alara if he could have his phone back. "Who told you I had your phone?" she said. "Ronan said you took it when I came in." He looked at her with the large, dark eyes that had been clouded with fever for most of the past week and were now clear and sharp and very young. "I want to call my sister." She looked at him. "You have a sister?" "Yeah." He looked slightly defensive, as if this was information he wasn't sure he should have shared. "She's 14. She lives with my aunt in Bridgeport. I was supposed to call her 3 days ago, and I didn't." Alara reached into the supply cabinet and retrieved his phone from where she'd been charging it and handed it to him without a word. He called his sister immediately, and she stood at the other end of the room, not listening to the conversation, and listening to it anyway. The particular texture of his voice when he talked to her. Lighter, younger, the organizational tension gone, just a boy calling his little sister to tell her he was fine. She was still standing there when the alley buzzer went off. She checked the monitor. A man she didn't recognize, standing in the alley in a rain jacket, bleeding through the left shoulder of it. She looked at the time. It was 11:40 at night. The rain had started an hour ago, and she could hear it on the basement-level windows. A low, steady percussion against the glass. She buzzed him in. He said his name was Garrett and that Ronan had sent him, and he said it quickly, before she could ask, which was either habit or a script. His shoulder wound was a through-and-through, clean entry and exit, no retained fragments, significant soft tissue damage, but no arterial involvement. She could manage it. She was 3 minutes into the cleaning when she heard the vehicles. Not passing traffic. Multiple engines, close, idling, and then stopping in the alley above. She heard Cal's voice outside the door. One short word, nothing she could make out. And then something that was not Cal's voice, and then nothing at all. She straightened up from the wound and looked at the monitor. The alley was full of headlights. She said, "Nico, get off the cot and get on the floor. Now." The first shot came through the foundation window at the far end of the room a half-second later. Not a bullet, something larger, something that blew the window inward in a shower of glass and concrete dust. And then the world became very loud and very wrong, very fast. The second shot took out the overhead surgical light. The room went from bright to fractured in a single second. One light still burning at half angle, throwing everything into hard shadow and wrong geometry. And Alara was already moving before she consciously decided to move, dropping behind the steel instrument tray and pulling it down with her because it was the heaviest thing within reach. And the sound coming through the blown window was not stopping. Nico had listened. He was on the floor beside the cot, flat on his stomach, his phone still in his hand, his face pressed sideways against the concrete. Garrett, the man with the shoulder wound, had fallen off the table when the first blast came through. She could see him in the half-dark, crouched against the base of the wall, his good hand pressed against his newly reopened wound, his face a mask of something that had moved past fear into a kind of flat animal survival calculation. The shooting lasted 40 seconds. She counted. Not deliberately. Her brain did it the way her brain did everything in crisis, breaking the chaos into measurable units, because measurable units were the only thing that could be navigated. 40 seconds of sustained fire through the foundation windows, through the alley door which was now hanging at a wrong angle from one hinge, through 2 places in the upper wall she hadn't known were structurally vulnerable until they demonstrated it by disintegrating. Then it stopped. The silence after was not actually silence. It was full of dust settling and broken glass, and the distant sound of engines accelerating away, and somewhere above her, the drip of a broken pipe starting up. But after the noise of the previous 40 seconds, it registered as silence, and her nervous system accepted it as such, and began, very slowly, the process of returning from pure emergency function to something more complicated. She stood up from behind the tray. "Nico," she said. Her voice came out steadier than she had any right to expect. "Are you hit?" "No." He lifted his head. His face was white under the remaining light. "No. No." "Stay down until I tell you otherwise." She moved to Garrett, checked him. The shoulder wound was bleeding again, as she'd expected, but the new damage was limited. He'd caught a fragment of something in his left forearm, a thin laceration 3 inches long, nothing that required immediate intervention. "Can you move?" she said. "Yeah," he said. The word came out scraped thin. "Then stay behind the table and don't touch anything until I assess the room." She was in the middle of assessing the room, moving through the debris, cataloging what was destroyed, what was salvageable, what structural elements might still be compromised. When the alley door came the rest of the way off its hinges, and Ronan walked through it carrying an assault rifle with the same expression he probably wore when he picked up groceries. He looked at the room. He looked at Alara. He looked at Nico on the floor, and his jaw tightened by a degree she was learning to measure. "Are you hurt?" he said to her. "No, Garrett needs his shoulder repacked. Nico is intact." She looked at Ronan. "Cal." Ronan's face did something very controlled and very brief. "He's alive. One of my other men has him." He took a round in the vest. 2 ribs, possibly broken. He's breathing. She breathed out. "Bring him to me." "Later. Right now I need you to—" "Bring him to me now, Ronan. Broken ribs with vest trauma can— I know what they can do." His voice was level. "Alara, I need you to listen to me. There's a vehicle outside. You need to get in it. I'm not leaving my patients. Nico can walk. Garrett can walk. Cal is being handled. You need to get in the vehicle." She looked at him. In the fractured light, with concrete dust on everything and the room around her in pieces, she looked at Ronan Vale and understood something she had been half understanding for the past 2 weeks. This was not a contained situation that she could manage from her basement. This had never been a contained situation. "Where is Silas?" she said. Ronan's eyes shifted, just slightly, just enough. "Where is he, Ronan?" "He's coming." She heard the second vehicle before she saw it. The deep sound of an armored SUV pulling into the alley, a different weight than the vehicles that had left. She watched the monitor, the one camera that was still functioning, and she saw the SUV stop, and she saw the door open, and she saw Silas Moretti step out. He was holding his left arm against his body. The way he was holding it told her everything before she got close enough to see the damage. The particular bracing posture of someone managing significant pain through deliberate stillness. The shoulder dropped, the elbow tucked, the whole left side of him slightly canted to protect what was underneath. He walked through the destroyed doorway and into the ruined clinic, and his eyes found her immediately, and the first thing he said was not what she expected. "How many injured?" he said. "Business. Assessment." Not "are you okay?" How many injured, because he was already calculating the next move. "Cal. Ribs. Vest trauma. Needs evaluation. Garrett. Shoulder wound. Reopened. Plus a forearm laceration. Nico is ambulatory." She crossed to him. "You." "I'm functional." "You're compensating for a left shoulder injury, and you've been doing it since you got out of the car." She reached for his arm, and he pulled it back reflexively, the way patients always did when they didn't want to acknowledge the severity of what they were carrying. "Silas, let me look at it." He looked at her for 1 second with an expression she couldn't fully read, something between refusal and the recognition that refusal was no longer a practical option. And then he let her move his arm. The coat was dark enough that she hadn't seen the blood until she touched it. The left shoulder of his jacket was saturated from mid-deltoid to the collar, warm and still seeping. She got the jacket off him with Ronan's help and found the wound underneath. Irregular, ragged-edged, the entry pattern of shrapnel rather than a bullet. Something had detonated near him, close enough to drive fragments through the coat and into the posterior shoulder, and she could see from the way the tissue was disrupted that there were multiple fragments at varying depths. "I need to operate," she said. "Not here. This room is compromised." She looked up at Ronan. "The penthouse." "The penthouse is 40 minutes away." "Then we have 40 minutes. She grabbed the emergency kit from under the instrument tray. It was still intact, miracle of miracles, and pressed a packed dressing against the wound and put Silas's right hand over it. "Hold pressure. Don't reduce the pressure no matter how much it pulls. Ronan, I need everything from that cabinet." She pointed. "That's still standing. Sterile drapes, the suture kit, the secondary instrument roll. Everything." Ronan moved. Silas stood in the middle of his own surgeon's destroyed clinic, with his right hand on his shoulder and his left arm hanging, and looked at the room around him with an expression that she would think about for a long time afterward. Not anger, not shock, something that was older and quieter than either of those things. The expression of a man seeing the confirmation of something he had always known was coming and had never quite finished preparing for. They knew exactly where to hit, he said. She was packing supplies into the emergency bag. What? The attack pattern, the angles they used. His voice was level. Not level the way someone forces levelness, level the way a deep channel of water is level, the current moving underneath without disturbing the surface. They knew the layout of this clinic. They knew the foundation window placement. They knew where the structural vulnerabilities were. She stopped moving. That's not possible. Someone gave them a blueprint, he said, or something close enough to one. She turned to look at him. Who has been in this clinic? Beyond my people? Beyond Ronan and Cal and the men who brought Nico in? His eyes met hers. Garrett. The name landed in the room with the particular weight of something that has been true for a while and is only now becoming visible. She looked at the corner where Garrett had been. Garrett was gone. Oh. The next 3 minutes were controlled chaos at a pitch she hadn't experienced since residency. Ronan out the door after Garrett. Before she finished saying the name, Silas moving toward the alley exit with a speed that alarmed her given the blood he'd lost. Nico pushing himself upright with one hand on the cot frame and his face set in an expression that was trying very hard to be older than 19. Stay here, she told Nico. Ronan just ran out. Stay here and do not touch anything in this room. If anyone comes through that door who isn't me or Ronan, you go through the back passage and up the fire stairs and you call the number in your phone contacts labeled service. She had made Ronan put that number in Nico's phone on day 3. She had not told anyone why. Do you understand me? Yeah. He swallowed. Yeah, I understand. She went out the alley door. The alley was wet from the rain, the gutters running, the air cold enough that her breath came out in small bursts. She could see Ronan 30 yards down, at the alley's intersection with the cross street, and she could see that whatever had been there was no longer there. He walked back to her with the rifle still in his hands, and the particular blankness of a man who has not found what he was looking for. He had a car, Ronan said. Staged. He knew the exit. She absorbed this. So he wasn't an accident. He wasn't a patient who just happened to show up tonight. No. Ronan's voice had gone somewhere very flat. He was sent here. Someone sent him here tonight specifically, knowing that if he was in your clinic when the attack came, either you'd be dead too, or you'd be too busy managing the chaos to... He stopped. To notice him leaving, she said. To notice what he was carrying out. She felt it before she understood it. A cold, specific dread settling into her chest. What do you mean? What he was carrying out? Ronan looked at her. Silas has been using this clinic as a secondary communication point. Encrypted drive. 3 weeks of operational logistics. The dread became something with actual weight. He was using my clinic to store operational data. It was the safest location we had. Off-network, off-grid. No, he was using my clinic, she said again, without telling me. Ronan's jaw set. He did not say anything, which was, she was learning, his way of confirming something he could not find a justification for. She went back inside. Silas was exactly where she'd left him, still holding pressure on the wound with his right hand, the color in his face several shades lower than it had been when he walked in. She crossed the room, picked up the emergency bag, and stood in front of him. We'll discuss it later, he said. He had seen her face. We'll discuss it in the car, she said. On the way to your penthouse, where I'm going to spend the next several hours removing shrapnel from your shoulder, and you're going to tell me everything. Elara, everything, Silas. She held his gaze. You used my clinic. You put me in the center of something I agreed to be on the edges of, and you did it without my knowledge, and now my clinic is destroyed and one of your men has a broken rib, and you have shrapnel in your shoulder, and I need to understand the complete picture. All of it. He looked at her for a long moment. His face in the single remaining light was stripped down to something she'd only glimpsed before. The version of Silas Moretti that existed when the control mechanisms were under too much strain to maintain their surface. Get in the car, he said. It was not a capitulation, but it was not a refusal either. The drive to the penthouse took 51 minutes because Ronan took a route that involved 3 unnecessary turns and a stretch of the expressway that doubled back on itself. And Elara understood without asking that this was anti-surveillance protocol. She sat in the back seat with Silas and kept two fingers on his radial pulse at intervals, monitoring the pressure dressing, watching his color. He told her things in the car that she had not known. The man who had ordered the attack was named Drevak, Marcus Drevak, who ran a trafficking operation and a money laundering network out of a legitimate logistics company based in Rosemont. He had been at war with Silas's organization for 14 months, a slow attrition conflict fought through proxies and deliberate escalation. 3 weeks ago, Drevak had lost two significant assets in a single week, a warehouse and a financial intermediary, and had decided that the most efficient response was not to attack Silas's operations directly, but to attack the infrastructure keeping his organization functional, the ghost surgeon. "He found out about you 6 days ago," Silas said. His voice was steady but effortful. She could hear the energy it cost him to keep it that way. "One of my people sold the information. We don't know who yet." She kept her fingers on his pulse. "Someone in your organization told Drevak about me." "Yes." "And you knew this 6 days ago?" "We suspected it. We didn't have confirmation until tonight." His jaw tightened. Garrett was Drevak's confirmation. He was sent to verify the clinic location and extract the drive. "And to be inside when the attack came," she said, "so it would look like a patient casualty. If he died in the attack, there'd be no trail back to Drevak." Silas paused. "Silas, he chose to run instead, which means we have a live link to Drevak's operation if Ronan can find him before Drevak can clean the connection." She sat with this for a moment. Outside, the wet city moved past the darkened windows. She thought about the 6 days Silas had known someone in his organization had given her up and had not told her. She thought about what those 6 days had contained, the supply deliveries, the operational conversations at the kitchen table, the evenings when he'd come to check on Nico and stayed longer than the pretext justified. She thought about all of it as a different kind of time than she'd experienced it as, and something in her chest that had been gradually, quietly warming over the past 2 weeks went very cold. "You knew someone had sold my location," she said. "You knew Drevak knew about me, and you kept me in that clinic." Silence. Just the road and the rain. "Silas, I had security on the building," he said. "You had 1 man outside the door. I had 3 in the building above you and 2 in the street and Cal at the alley. It should have—" He stopped. "It should have been sufficient." It wasn't sufficient. "No." The word came out with a flatness that was worse than anger. It wasn't. She looked out the window. Her hands were in her lap. She was aware of the destroyed clinic behind her and the drive ahead, and the shrapnel in his shoulder, and the fact that someone in his organization had sold her for information, and she felt all of it simultaneously in a way that was almost too large to process, so she stopped trying to process it and simply held it. "The drive," she said. "The operational data Garrett was supposed to extract. Still in the clinic. He didn't have time. So Drevak sent a man to extract 3 weeks of your operational logistics from my clinic, failed to get them, and destroyed the building in the attempt." She turned back to look at him. "Which means he'll try again." "Yes." "Where?" "The data is in a destroyed basement clinic." "Drevak doesn't know Garrett failed to extract it," Silas said. "And he won't, until Garrett surfaces. Which means we have a window." "A window for what?" "To retrieve, to use it." He held her gaze. "The data on that drive isn't just operational logistics. It includes communication records, names, 3 of Drevak's intermediaries, and 2 of his financial contacts. It's the infrastructure of his network." He paused. "If we have it, and he thinks we don't, we can dismantle him from a direction he won't see coming." She looked at him, at the pallor under his composure, at the blood seeping slowly through the dressing she'd applied, at the man who had upended her life and endangered it, and was currently sitting beside her in an armored vehicle explaining, with genuine strategic clarity, how to leverage the disaster he'd created. "You need surgery," she said. "Before anything else, you need surgery." "I'm aware. And after surgery, we're going to have a complete conversation about what I knew and what I didn't know, and what you decided for me without asking." He held her gaze. "Yes. I'm not done being angry about this." "I know." She looked back at the window. The city was thinning out as they moved toward the West Loop, the streets wider, the lights more spaced. She thought about the drive in the destroyed clinic. She thought about Garrett running through a wet alley with a shoulder wound and 3 weeks of Silas Moretti's operational infrastructure in his hands. She thought about the question she hadn't asked yet, the one that had been sitting at the back of her mind since Ronan said the word blueprint. The clinic layout, she said. You said they knew the structural weaknesses, the window placement. Silas said nothing. Who drew up the layout? When I started setting up the space, someone assessed it for security. Ronan told me a security team had been through it before I moved in. She turned back to look at him. Who was on that team? His expression shifted. Something underneath the composure moved in a way she hadn't seen before. There were 4 people, he said slowly, and one of them sold Drivak my location 6 days ago. We assumed it was a more recent breach, but it might not be. She felt the coldness in her chest sharpen into something with a finer point. It might be someone who has had the blueprint since the beginning, since before I was even operational. The car was quiet for a long moment. Ronan's eyes moved briefly to the rearview mirror and then returned to the road. Silas said, and the way he said it, with the specific flatness of someone who has just watched a belief they held about a person begin to dissolve, told her that he already had a name forming in his mind. One of the 4 has been inside this from the start. Who? She said. He didn't answer immediately. He looked at the back of Ronan's head, and she watched something pass between them. The look of 2 people who have worked together long enough to communicate in something shorter than language. Ronan's hands tightened on the wheel. His name is Callum Dress, Silas said quietly. He's been with me for 11 years. The surgery took 2 hours and 40 minutes. She worked in the penthouse kitchen, which she had converted to a functional surgical space with the supply kit and the portable lighting unit Ronan had thought to bring from the clinic. It was not ideal. The surface height was wrong. The ambient light kept wanting to create shadows in the wrong places. And she had to work with Ronan as her surgical assistant, which meant spending the first 15 minutes teaching him what she needed from him and trusting that his hands, which were very large and very controlled, would follow instruction. They did. She removed 7 fragments from Silas's posterior shoulder. Most were small, 3 to 5 millimeters, jagged, with the irregular geometry of detonated metal rather than machined projectile. 2 were larger, had traveled deeper. One of them lodged against the posterior capsule of the shoulder joint in a position that required her full concentration and a degree of patience she had to actively maintain because her hands kept wanting to move faster than precision allowed. Silas did not make a sound through any of it. Not because he wasn't feeling it, she knew from the way his blood pressure moved on the portable monitor that he was feeling all of it. He lay face down on the kitchen table with his right cheek against the towel she'd folded under him and his right hand flat on the table surface. And every time she went for a deep fragment, he pressed his fingers into the table edge and held them there until she was done. When she finished, she stood back and stripped off her gloves and noticed that her hands were shaking. Not badly. Not the uncontrolled shaking of someone who'd lost composure, the fine tremor that comes from sustained precision. Work under emotional stress, the kind she'd had after difficult surgeries in residency, the kind she'd learned to wait out. She sat down in the kitchen chair and breathed. Ronan cleaned up with quiet efficiency. Silas lay still on the table, the dressing on his shoulder fresh, and the anesthetic beginning its slow exit from his system. Callum Dress, she said to the room, to whoever was listening. Where is he now? Ronan's back was to her. He was bundling the used drapes. Reached out to him 40 minutes ago. He's not answering, which means he knows we know. Or he's running. Ronan set down the bundle. Or Drevak already has him. She looked at Silas. He had turned his head on the folded towel and was watching her from across the room with the expression of someone who is very tired and is not going to say so. If Drevak has him, she said, how much does he know? Silas closed his eyes. Everything, he said. If Callum has turned, Drevak knows everything. The supply chain, the secondary locations, the financial structure. A pause. The penthouse. The words settled in the room and nobody moved for a moment. Ilara looked at the floor-to-ceiling windows. All that glass, all that exposed light, 40 floors up, but exposed in every direction to the buildings across the street and the buildings beyond them. We need to move, she said. Silas opened his eyes. I just had surgery. I know, I performed it. She stood up. which means I know exactly what you can and cannot do in the next 12 hours, and what you cannot do is lie on a kitchen table in a compromised location while someone who knows the layout of this building is either talking to Marcus Drevak or being used to lead Drevak's people here. She looked at him. Where can we go? He looked at the ceiling for a moment. Then he said a name, a location, a building on the south side she didn't know, and looked at Ronan. Ronan nodded once. I can have it ready in 20 minutes. Then we have 20 minutes, Silas said, and he began slowly and with considerable effort to push himself upright. She was beside him before she made a conscious decision to be there, her hand under his right arm, steadying, not holding, the difference important in a way she couldn't have explained. He looked at her hand. He looked at her face. I should have told you about the drive, he said. Yes. She kept her hand where it was. You should have told me a lot of things. I know. We're going to address all of it. She held his gaze. When you're stable and we're somewhere safe, and I've had 4 hours of sleep, we are going to sit down and you're going to tell me every single thing that is happening around me that I don't know about. And you're going to do it completely. He looked at her for a moment. And if I don't? Then I walk, she said. Destroyed clinic, active threat, no income. I'll manage. I've managed worse. She didn't look away. But if I stay with full information. Those are the only terms I have. Silas Moretti, with a freshly sutured shoulder and someone else's blood on the table behind him, held her gaze for a long moment. All right, he said. It was the quietest thing he had said to her yet. It was also, she understood, the most significant. She helped him to his feet and they moved toward the door. And somewhere in the city below them, a man named Callum Dress, who had spent 11 years inside Silas Moretti's trust, was either running or talking, and the information he carried was enough to bring everything down. And Alara Voss, who had come into all of this through a basement door and a paper bag of soup, was now at the center of it with no distance left to retreat to and no version of the next hours that did not require her to be exactly what she was. Relentless, clear-eyed, and unwilling to break. The safe house was a converted print shop on South Halsted, 3 stories of brick and reinforced steel that looked from the outside like every other shuttered commercial building in the block. Painted over windows, a rusted roll-up door, a faded sign above the entrance that said Meridian Press in letters nobody had bothered to remove. Inside it was something else entirely. A generator, running water, a clean second-floor space with actual beds and a functional kitchen. And on the ground floor a room that Ronan unlocked with a key he kept on his body that contained, among other things, a weapons cache and a communications setup that made the penthouse look casual. Alara did not comment on the weapons cache. She got Silas into one of the beds on the second floor and checked his dressing and his pressure and his temperature and told him that the shoulder was going to be significantly more painful in 4 hours when the local anesthetic was fully metabolized and that she needed him horizontal until then. He looked at the ceiling and said nothing, which she was learning to read as agreement under protest. She went downstairs. Ronan was at the communications terminal with his sleeves rolled up and a phone to his ear and the particular focused stillness of someone receiving information they are processing in real time. She stood in the doorway and waited. He finished the call and set the phone down and turned to look at her. Callum Dress checked out of a hotel in Oak Park 40 minutes ago, he said. Paid cash. Used a name we didn't know he had. Which means he's been running a secondary identity. For at least 2 years. Ronan's jaw was tight. Which means this didn't start 6 days ago. He's been preparing an exit for 2 years. She absorbed this. So the breach isn't recent. No. He sat back in the chair. We're going back through everything now. Every operation in the past 2 years that went sideways. Every location that got burned. Every time we moved something, and Drevak seemed to know where it had been. He paused. There's a pattern. It's not small. She moved into the room and sat down across from him. The generator hummed in the walls and the rain was still going outside, hitting the painted-over windows in irregular bursts. What does Drevak do now? If Callum is running, if Drevak knows we survived the clinic attack, he accelerates, Ronan said. He can't afford to let Silas stabilize. If we get time to regroup, to use what's on that drive, he stopped. The drive is still in the clinic. Yes. In a destroyed basement that Drevak's people hit 8 hours ago. She looked at him. Can you get it? Ronan was quiet for a moment. I sent 2 men back there an hour ago. The drive is in a false panel in the supply cabinet. The cabinet that was still standing when we left. He paused. They haven't reported back yet. She felt the cold thing in her chest again. How long ago? An hour and 10 minutes. And they should have checked in 40 minutes ago. His voice was flat. Yes. She looked at the phone on the table. Drevak got there first. Or Callum told him where to look. Ronan stood up. Either way, if his people have the drive, we've lost our leverage window. Everything on it, the names, the financial contacts, the intermediaries, Drevak can start burning his own network before we can use any of it against him. Can he find us here? Ronan met her eyes. Callum knew about the print shop. The sentence sat between them like a stone dropped into water, and she watched the implications spread outward from it in concentric rings, each one larger and more damaging than the last. So we can't stay here, she said. Not past dawn. She stood up. Then we need to move Silas before his anesthetic wears off, because once it does, he's going to be in significant pain and significantly less mobile. She looked at the door. And I need to know where we're going before I tell him, because he's going to want operational details, and I'm not going to be able to give him "we'll figure it out." Ronan almost smiled. It was the ghost of one, the faintest trace. There's a place. West Side. Drevak doesn't know it. Callum doesn't know it. It's off every list I've ever made. Whose is it? Mine, he said. Simply. She looked at him. You have a place nobody knows about. Everyone has a place nobody knows about. He held her gaze. The question is whether you trust me enough to take Silas there. She thought about Ronan in the alley with an assault rifle checking whether she was alive. She thought about the paper bag of soup at 2 a.m. She thought about him standing in a corner for 4 hours watching her operate on Nico without once asking if she needed help, because he was smart enough to understand that the help she needed was to not be interrupted. I trust you, she said. He nodded. No performance around it. Just a nod and then movement, because Ronan Vale was not a man who wasted time on acknowledgement when there was action available. Silas was awake when she went back upstairs. He was sitting on the edge of the bed with his right hand on his left forearm, monitoring his own circulation the way she'd taught him, checking capillary refill, feeling for pulse. He looked up when she came in. We're moving, she said. When? 90 minutes. Ronan has a location. She sat down on the chair across from him. Before we move, I need to tell you something. His eyes sharpened. The drive. Ronan's men went back for it. They haven't checked in. He was quiet for a moment, the kind of quiet that has weight. Drevak has it. Possibly, probably. She held his gaze. Which changes things. It changes everything. He said it without heat, without the kind of reactive anger she might have expected. He said it with the same weight he'd said everything in the car. The particular gravity of a man who is calculating the destruction of his own position in real time and doing it without flinching. Without that drive, we have no leverage. Drevak can move freely. He knows where we were, he knows who Callum burned, and if his people have the communications data, he knows your financial structure. He knows enough to make very targeted moves against the people who keep my organization funded. He looked at the floor. 3 people, maybe 4. If Drevak hits them in the next 48 hours, I don't have an organization. I have a building and a weapons cache and 12 loyal people. She thought about what she was going to say before she said it. Is there another copy of what's on that drive? He looked up. You're a man who plans for contingencies, she said. You built a false panel into my supply cabinet. You have a safe house that runs a generator and a communications terminal. You have a secondary identity protocol that I'm guessing extends to more than just Callum Dress. She held his gaze. Is there another copy? He looked at her for a long moment. Not a copy, he said. But there's a man who knows everything that's on it, who built the original network, who has the contact information and financial infrastructure memorized because he built it, and he's never trusted digital records. He paused. His name is Werner Haas. He lives in a house in Bridgeport and hasn't left it in 4 years because his legs don't work, and he has a condition that makes travel nearly fatal. And Drevak knows about him? Drevak doesn't know Werner exists, Nobody outside my core four knows Werner exists. He paused. Callum knew. The weight of it landed on her fully. Callum knew. Yes. She stood up. Then we have less than 90 minutes. She crossed to the door. Ronan, now. The next 6 hours were the longest of her life, and she had spent residency on 36-hour shifts. Ronan drove them to Bridgeport in a car she'd never seen, nondescript, anonymous, the kind that could park anywhere and disappear. Silas sat in the back with her, his left arm in the sling she'd improvised from a cut strip of nylon webbing, his color holding but his jaw tight in the way it got when the anesthetic was losing ground. She tracked his pulse at intervals without asking permission, and he let her do it without comment, which she was coming to understand was a form of trust specific to him. Werner Haas was 71 years old, rail-thin, with sharp eyes behind thick glasses and the kind of stillness that comes from spending years in a body that doesn't move well. He opened his front door at 4 a.m. wearing a cardigan and an expression that suggested he had been expecting exactly this knock for some time. "Silas," he said. Then he looked at Alara. "And you are?" "His surgeon," she said. Werner looked at Silas's shoulder and the sling. "So I see." He stepped back from the door. "Come in." The inside of Werner's house was everything the print shop wasn't, full of paper, full of books, full of the accumulated weight of a man who had spent decades inside an information network and had never quite been able to separate himself from the physical evidence of it. Files on shelves, maps on walls, a desk with 2 monitors and what looked like a hand-built communications router. "Callum, dress," Silas said, without preamble, before Werner had finished closing the door. Werner's expression did something small and painful. "I know." Silas went very still. "What do you know?" "I know he's been running a secondary channel to Drivac's organization for somewhere between 18 months and 2 years. Werner moved to his desk with the rolling gait of someone whose hips don't cooperate and sat down heavily. "I suspected it 14 months ago. I brought it to you and you told me I was being paranoid." Silence. Alara watched Silas absorb this. It was not a comfortable thing to watch. She watched the muscles in his jaw work and his right hand close around nothing and then release. "You told me," Silas said very quietly. "I told you." Werner's voice was not unkind. It was simply exact. "You said Callum had been with you 11 years, and you trusted him, and I should look elsewhere for my source." He paused. "I kept looking anyway. I found partial evidence. Not enough to confirm, enough to worry about. I documented it." He turned to the monitor and began pulling up files. "I have 17 months of irregular communication patterns, 2 instances of operational details reaching Drivac within 48 hours of being discussed in contexts where only Callum had access, and 1 piece of data I've been sitting on for 3 weeks. "What piece of data?" Silas said. Werner pulled up an image on the monitor. "A payment record, offshore. 14 months of quarterly deposits into an account held under Callum Dress's secondary identity, the one he just used to check out of the Oak Park Hotel." He paused. "Drivac has been paying him since the beginning." The room was very quiet. Silas turned away from the monitor. He walked to the far side of the room. Slowly, because his shoulder was pulling now, she could see it in the set of his whole left side, and stood with his back to them for a moment. She watched his right hand find the windowsill and grip it. "The drive," she said to Werner. "What was on it? Can you reconstruct it? The names, the contacts, the financial infrastructure." Werner looked at her with the measuring quality of someone deciding how much weight to give a person they've just met. "It's in here." He touched his temple. "I built it. I can reproduce everything on it in 48 hours. We may not have 48 hours. How much do we have?" She looked at Silas's back. "Silas, Ronan said Drivac moves on the financial contacts within 48 hours if he has the drive. How long does it actually take him to activate?" Silas turned back from the window. His face was something she had not seen before. Not the controlled blankness of the penthouse. Not the stripped exhaustion of the clinic. Something that was older than both of those things. Something that had the quality of a man looking at a mistake he made with open eyes, and no longer has the option of looking away from. "Drivac doesn't wait," he said. "He moves when he has what he needs. If his people pulled that drive 2 hours ago, he's already started." Then we start now, she said. She looked at Werner. What do you need? Coffee, Werner said immediately, and for whoever that large man in your hallway is to come inside and stop standing in my doorway. Ronan came in. They worked through the early morning, Werner at the keyboard, pulling architecture from memory, with the systematic precision of someone for whom information was never abstract. Ronan managing the communications from his own terminal and deploying the people he had left to positions Werner identified as vulnerable. Alara kept herself useful. She tracked Silas's condition across the hours, managed his pain with what she had in the emergency kit, made Werner's coffee, and when Silas insisted on being part of the operational conversation, she positioned herself where she could monitor him without making it obvious. At 6:40 in the morning, Ronan's phone rang. He listened. His face did not change. He said 2 words and hung up. Garrett surfaced, he said. He's at a hospital in Evanston. Checked himself into the ER an hour ago. The shoulder wound reopened. He's alive, Alara said. He's talking. Ronan looked at Silas. The hospital has him listed under a name we don't know, but one of my people monitors ER admissions at 6 hospitals in the metro area. He paused. He's talking to someone. Person showed up 20 minutes after he checked in. Civilian clothes, no ID visible on the hospital footage, but the body language. Drevax, Silas said. Or Drevax contact. Yes. Then Garrett is telling them the drive is gone, Alara said. He'll tell them he couldn't get it, and Drevac will know his attack didn't accomplish what he planned. Which means Drevac pivots, Silas said. He looked at Werner. How far are you? 2 hours? Werner said without looking up from the screen. Maybe less. Make it less. Silas looked at Ronan. The financial contacts. Which ones are most exposed? Ronan pulled up his tablet. Varga and the Kostov brothers. If Drevac moves on anyone in the next 6 hours, it's them. Get people to them. Already moving. Ronan was already on the phone again before the sentence was complete. Alara stood up and crossed to Silas. She put 2 fingers on his radial pulse, counted, and frowned at what she found. Your heart rate is elevated. I'm aware. It's elevated in a way that isn't entirely explained by stress. He looked at her. What's the other explanation? Infection is possible if the wound is reacting. Pain is more likely. The anesthetic is gone and you've been using that shoulder for the past 2 hours against my explicit instructions. She reached for his arm. Let me look at the dressing. We're in the middle of... Silas. She held his gaze. If you're developing a fever and you collapse in the next 4 hours, you lose everything. 90 seconds. Let me look. He exhaled. He let her look. The wound was not infected. The tissue around the dressing was warm but not hot. No red tracking, no abnormal discharge. The pain was real and significant, and she could see it now in the lines around his eyes, lines that hadn't been there this clearly before. The physical cost of the night-collecting interest. She adjusted the dressing and gave him what remained of the analgesic in the emergency kit, which was not enough, but was something. Thank you, he said quietly. Don't thank me. Stop using the arm. When this is over. It's always when this is over. He looked at her. The distance that had existed between them in every conversation they'd had, the professional buffer she'd maintained, the careful ledger of obligation and consent and terms, that distance was considerably shorter than it had been 12 hours ago, and they both knew it, and neither of them was addressing it directly, because there was too much still unresolved, and the room was full of other people, and the morning was accelerating around them. Werner said, I have the contact list, all 12 names, financial structures, communication protocols. He looked up from the screen. It's done. The room shifted. Can you transmit it? Silas said. I can transmit it to anyone you specify in a format that is both actionable and deniable. Werner's eyes were sharp behind his glasses. But I want to talk about what we do with it, because the question isn't just whether we protect your financial contacts. The question is whether we use this to end Drevac. Silas looked at him. I've been building this architecture for 11 years, Werner said. I've watched Drevac's operation grow into something that costs people their lives on a monthly basis. Not your people, civilians. People who are adjacent to his trafficking routes and his money laundering and the violence he uses to maintain both. He looked at the monitor. I have everything on here that a federal task force would need to dismantle his entire network. Not just hurt him, end him. The room was very quiet. Alara looked at Silas. He was looking at Werner with the expression of someone navigating a calculation that has suddenly become significantly more complex than it was 60 seconds ago. "You're talking about going to the authorities," Silas said. "I'm talking about giving information to the right person in the right way so that Drevak's network is dismantled while your organization's exposure remains manageable." Werner folded his hands on the desk. "I've had a contact for 3 years. Someone inside a federal structure who is not interested in you, who has been trying to build a case against Drevak specifically, and has been unable to because Drevak is very careful about his digital footprint." He paused. "Until now." "If you do this," Silas said, "everything changes." "Everything is already changing." Werner held his gaze. "The question is who controls how it changes." Ronan was standing near the door with his arms at his sides and his face neutral and his eyes moving between Silas and Werner with the careful attention of someone who has strong opinions and is choosing not to deploy them yet. Alara looked at Silas. He was looking at the floor between himself and Werner's desk, and she could see the calculation moving behind his eyes, the weighing of it, the old architecture of how he'd always operated against the new reality that Callum Dress had opened under his feet, and the clinic attack had confirmed. His phone buzzed. He looked at it. His expression changed, not dramatically, not with any visible reaction, but in the specific way of someone who has just received information that rearranges every assumption they were currently working from. He held the phone out to Ronan. Ronan read it. His jaw went tight. "What?" Alara said. Ronan looked at her. "Drevak is not moving on the financial contacts," he said. "He's moving on something else." He paused. Someone sent him Ronan's address. This address. Berner's house. His voice was very controlled. "Someone sent it 11 minutes ago." She looked at Werner. Werner was already reaching for something under the desk. A go bag, she realized, the kind of pre-packed emergency bag that someone keeps within arm's reach when they've spent decades inside the kind of work Werner had spent decades inside. "How long?" she said. Ronan was already at the window, looking out at the street. The sky outside was the pale gray of very early morning, the light not fully formed, the neighborhood still in that suspended quiet before the city fully woke. He looked for 3 seconds, and then he turned back to the room. "They're already on the block," he said. And Silas Moretti looked at Alara Voss across Werner Haas's small, book-crowded room with a freshly sutured shoulder and 12 hours of compound disaster behind him. And the next 3 minutes completely unwritten, and what she saw in his face in that moment was not fear and was not calculation. It was the look of a man who has run out of controlled variables and is standing, for the first time in a very long time, in territory that is entirely open. Ronan did not wait for an order. He crossed the room in 4 strides, grabbed the go-bag from Werner's hands, and had his phone to his ear before he reached the door to the back of the house. Alara heard him speaking in a low, rapid voice to someone she didn't know, and she was already moving to Silas, not to support him, not to check his pulse, but to stand beside him the way you stand beside someone when the options have narrowed to the point where proximity is the only thing left to offer. "How many ways out?" Silas said to Werner. 3. Werner was already moving, rolling his chair toward the hallway with practiced efficiency. Back door to the alley. Basement passage to the building next door. It was a shared laundry facility in the 1970s. The connecting wall has a door that's never been registered on any city plan. And the roof, if your shoulder can manage a ladder. "Not the roof," Alara said. "Back door and the passage," Silas said. "Werner, can you move fast enough?" "Faster than you, with that shoulder." Werner looked up at him with something that was not quite a smile but occupied the same neighborhood. "I've been preparing to leave this house on short notice for 6 years. Don't patronize me." They went through the back. The alley behind Werner's house was narrow and ran between 2 rows of brick buildings, the garbage containers creating a broken line of cover, the pavement wet and dark in the early morning half-light. Ronan was already there, his back to the wall beside the door, his eyes on the alley entrance. He held up 2 fingers when he saw them, pointed toward the south end of the alley, and shook his head at the north. South only. North was already closed. They moved south. Silas in front, Werner's chair making almost no sound on the wet pavement. The man had clearly oiled it with the same attention he gave everything else. And Alara at the rear, her emergency kit over one shoulder, her eyes tracking the windows above them and the shadows between the containers and the angles that bothered her. The angle that bothered her most was the building at the end of the alley, where the south exit opened onto a side street. It was too quiet. The early morning was always quiet, but this was a different quality of quiet, the kind that has been deliberately constructed. She grabbed Silas's arm. "Stop." He stopped. She looked at the exit, looked at the way the light fell wrong at the corner, the shadow that was slightly denser than the shadows beside it, the shape inside the density that was not a garbage container. "There's someone at the exit," she said quietly. Ronan was already repositioning, moving silently to the side of the alley and pressing into the gap between two containers, his eyes on the same corner. Werner said nothing. He sat in his chair and watched the exit with the patient attention of someone who has learned that panic is simply wasted processing power. Silas looked at the shape in the corner. He looked at Ronan. Something passed between them. The compressed communication of two people who have handled enough bad exits to have a shared language for them. And then Ronan moved. What happened in the next 40 seconds was not something Alara could fully track in real time. It was fast and purposeful and involved. Ronan creating a sound at the north end of the alley, deliberately, with a piece of metal from his jacket that he threw against the brick, and the shape at the south exit moving toward it, and Silas moving in the opposite direction with a speed. His shoulder cost him considerably, pulling the connecting building's door open from the outside with his one functional arm, while Alara got Werner's chair through the gap, and then herself, and then Silas, and the door closed behind them a moment before she heard voices in the alley outside. The connecting basement was dark and smelled of damp and old detergent and 70 years of disuse. Werner produced a small flashlight from the go bag with the matter-of-factness of someone who has thought through exactly this situation. 40 feet, he said, then stairs up to the building's first floor. There's a side exit onto Loomis. Ronan came through the door behind them 30 seconds later. He was breathing harder than she'd ever heard him breathe, which meant that whatever had happened in the alley after the door closed had required something from him. He had a cut on his left forearm. She registered it, filed it, prioritized it below the immediate navigation problem. They came out onto Loomis into the thin early morning light. A car was waiting. She didn't recognize it, didn't recognize the driver, but Ronan went to the passenger window and exchanged 3 words and got into the back, which was apparently sufficient verification for everyone present. She helped Werner into the back seat, collapsed his chair, and put it in the trunk, and got in beside Silas as the car pulled away from the curb at normal speed. Not fleeing, just moving, just another car on a Chicago street at 6 a.m. She looked at Silas. He was pale in a way that had moved past the pallor of pain into something that needed attention. She put her fingers on his wrist. His pulse was rapid and shallow, the rhythm of someone whose body was running a serious deficit. "You're crashing," she said quietly. "I'm functional." "You keep using that word incorrectly." She kept her fingers on his wrist. "You've been running on adrenaline for 6 hours with a surgical wound and inadequate pain management and no sleep. Your body is calling the debt in." She looked at him. "Where are we going?" Ronan answered from the front seat. "There's one more location, off every list. Even Werner doesn't know it." Werner, in the back corner, raised an eyebrow but said nothing. "How far?" she said. 20 minutes. "Then he has 20 minutes before I insist on stopping." The location was a ground floor unit in a residential building in Wicker Park, accessed through a parking garage, and a stairwell that required 2 keys Ronan carried on separate rings. Inside it was clean and spare and had the feeling of a place that was maintained without being inhabited. Everything present that was needed, nothing present that wasn't. A couch, a bed visible through one door, a kitchen with supplies, a bathroom. She put Silas on the couch. He didn't argue, which told her more about his condition than any vital sign. She got his coat off and removed the sling and examined the wound under the apartment's clean light. The dressing had held. The tissue was not showing infection, but his skin was clammy, and his pressure when she measured it with the cuff from the emergency kit was lower than she wanted, and his hands, when she held them briefly to check his grip strength, were trembling in the fine continuous way that meant his reserves were at their floor. "I need you to lie down," she said, "and stay down, for a minimum of 3 hours." He looked at her. His eyes were still sharp. His mind was still completely present, which she found both reassuring and slightly alarming, because it meant he was running the remaining function of his body through sheer will, and will had a harder ceiling than physiology. Werner needs to make contact with his federal source, Silas said. That needs to happen in the next. Werner can do that from this apartment, she said. Ronan can manage whatever operational pieces need managing from this apartment. You can participate in decisions from a horizontal position. She held his gaze. Silas, I am telling you, as your physician, that if you do not rest right now, your body will make the decision for you, and it will make it at the worst possible moment. Do you understand me? He looked at her for a long moment. Yes, he said. He lay down. She sat beside the couch and watched his breathing slow and his eyes close. And she thought about all the ways a person could be strong and all the ways strength could become the thing that damaged you. And she thought she understood him a little better than she had 12 hours ago. And she was not sure what to do with that understanding. Werner made contact with his federal source at 8:17 a.m. She was in the kitchen making coffee. She genuinely needed when she heard the conversation start in the other room. Werner's precise, unhurried voice laying out information to someone on the other end with the practiced clarity of a man who had been structuring intelligence for a very long time. She could not hear the other side of the conversation. She did not try. Ronan sat at the kitchen table across from her with his forearm on the surface between them, the laceration from the alley still uncleaned. She had antiseptic and closure strips in the emergency kit. She cleaned the wound and closed it with 4 strips, and he sat perfectly still through all of it, and then said, "Thank you," with the same economy he applied to everything. "It needs stitches properly," she said. "Later." "That's what Silas says." "We learned it from the same place." He looked at the closed door to the other room. "Werner's contact is solid. I've known about the contact for 2 years. Werner told me in case something happened to him. The contact has been building a Drevac case for 4 years. What Werner has will close it." She absorbed this. "And Callum Dress." Ronan's jaw moved. "There are people looking for him." "Drevac's people or yours?" "Both." He looked at the surface of the table. "He ran because he knew we'd find out. That means he planned for this moment. He had the secondary identity, the cash, the exit. He's been ready to run for at least 2 years. 11 years, she said. He was with Silas for 11 years. Yes. She thought about what that meant. About the texture of 11 years, the accumulated weight of shared history, the particular violence of a betrayal that had been planned inside a trust that took a decade to build. She thought about Silas's face when Werner said, "I told you," and the way his hand had closed around nothing. "Is Silas going to be all right?" she said. She didn't mean the shoulder. Ronan looked at her. It was a long look, the kind he usually reserved for exit assessments. "That probably depends on a few things," he said. "Some of which are medical, some of which are not." She looked at her coffee. "He doesn't let people in," Ronan said. "In 11 years I have watched 3 people get past the exterior. Werner, because Werner was there before the exterior fully formed. Nico, because Nico reminded him of someone he couldn't save when he was younger." He paused. "And you?" She kept her eyes on the coffee. "I'm his surgeon." "You're something more than that, and we both know it." He said it without any pressure behind it, without any implication. Just a fact, laid on the table between them with the same plain precision he applied to everything else. "I'm not telling you what to do with it. I'm telling you it's real, because someone should." She looked up at him. Ronan Vale, who communicated primarily through omission, was looking at her with an expression that was as close to openness as she suspected his face could produce. "Thank you," she said. He nodded. He picked up his coffee, and they sat in the kitchen in silence, and the morning moved outside the windows. At 11:40 a.m., Werner came out of the other room. "It's done," he said. He looked tired in a way that went deeper than the night, the tiredness of someone who has been carrying a weight for a long time, and has just set it down and is feeling the absence of it. "My contact has everything, the full network architecture, the financial structure, the communication records going back 14 months, the intermediaries, the trafficking routes, the money laundering channels." He sat down at the kitchen table. "They'll move on Drevac within 72 hours, coordinated. Multiple jurisdictions simultaneously so he can't collapse one and protect the rest." Alara looked at him. "And your contact's exposure? Your exposure?" My contact is insulated by the structure of the arrangement, has been for 3 years. Werner folded his hands on the table. My exposure is managed through a separate agreement that's been in place for 4 years. I don't exist, legally speaking, in any context that implicates what I do for Silas. He met her eyes. I'm a retired systems engineer who lives quietly in Bridgeport. That's what every piece of paper in the world says about me. And Silas's organization? The information I provided targeted Drivak specifically. The exposure of Silas's network is limited to what Callum Dress can testify to, and Callum has his own significant legal exposure, which means any cooperation agreement he seeks will come with conditions that limit how much he can say about Silas without implicating himself. Werner's eyes were sharp and steady. It's not clean. It's never completely clean. But it's manageable. She nodded slowly. There's one more thing, Werner said. He reached into the go bag and produced a small drive, different from the one that had been in the clinic, newer, smaller. This is a copy. Everything I gave my contact, I kept a version of, because information is only as useful as its redundancy. He set it on the table. I'd like Silas to have it when he wakes up. She took it. He woke at 1 in the afternoon. She was in the chair beside the couch, reading a 3-year-old magazine she'd found in the apartment's single bookshelf, which said something about how whoever maintained this place lived the same way Ronan operated, prepared for everything, nostalgic about nothing. She looked up when she heard his breathing change from the deep rhythm of actual sleep into something more present. Silas opened his eyes. He looked at the ceiling. He looked at his left arm, the sling, the dressing. He looked at her. You stayed, he said. You needed monitoring. That's not why you stayed. She set the magazine down. No, she said. It's not. He shifted carefully to a more upright position, using his right arm, and she let him because she could see from the way he moved that he was genuinely better. The color was back in his face. His movements were controlled rather than compensating. The tremor in his hands was gone. Sleep had done what she couldn't do with any instrument she owned. She handed him Werner's drive. He looked at it. She told him what Werner had done. She told it cleanly and completely, without editorializing, and watched his face move through the information the way water moves through an uneven surface, finding the low points, settling into them, adjusting to the new geography. When she finished, he was quiet for a long time. He gave the contact everything, Silas said finally. Everything on Drevak. The exposure to your organization is manageable. Werner's word, and I think Werner chooses his words very carefully. He does. Silas looked at the drive in his hand. He's been protecting me for 11 years. I handed him a reason to doubt me 14 months ago when I dismissed what he was telling me about Callum, and he kept protecting me anyway. She said nothing. He didn't need her to say anything. I was wrong about Callum, he said. It came out flat and exact, without the rhetorical softening that people usually apply to their own failures. I trusted 11 years of history over Werner's evidence. That's not loyalty. That's sentimentality dressed up as loyalty. And it cost... He stopped. He looked at the window. It cost a lot, she said quietly. Your clinic. Yes. Cal's ribs. He'll heal. The 2 men I sent back for the drive. He looked at her. I don't know yet if they're alive. She held his gaze. Ronan is working on that. He nodded. He turned the drive over in his hand. Outside, Chicago was doing what it always did, massive and indifferent and full of its own motion. And inside this spare, careful room, Silas Moretti sat on a couch with a sutured shoulder and looked at the evidence of the ways 11 years of misplaced trust could reshape a world. I owe you a complete accounting, he said. Everything I knew and didn't tell you. Everything I decided for you without asking. He looked at her directly. I intended to use the clinic as a buffer. If anyone was tracking my organization's communications, the clinic would register as a peripheral location rather than a core one. It would absorb surveillance attention before it reached anything central. She processed this. You used me as a decoy. I used the location as a decoy. He held her gaze. I told myself there was a distinction. Is there? He was quiet for a moment. No, he said, there isn't. She sat with that. She had known, at some level, since the moment in the car when she'd understood what had been in the clinic all along. She had known, and she had not let herself fully form the knowledge because there was too much else to manage. Now, in the quiet of the afternoon, she let herself form it completely. "I could have died in that attack," she said. "Yes." "And you knew the threat level was elevated." "Yes." "And you increased my security and told yourself that was sufficient." "Yes." He didn't look away. "It wasn't." She breathed. "Okay," she said. He looked at her. "Okay?" "I'm not forgiving you," she said clearly. "I'm not doing that quickly or easily, and I'm not going to pretend the anger isn't real because it is. But I'm also not— I know what you are, Silas. I knew when I sat across from you in that office. I know the way you're built and why and what it costs." She looked at her hands. "What I need from you going forward, if there is a going forward, is what I told you in the car. Full information, no decisions made for me without me." She looked up. "Can you do that?" He held her gaze for a long moment, the longest she'd seen him hold anyone's gaze without the calculation running visibly underneath. "I don't know," he said. "Honestly, I have spent 20 years making decisions for the people around me because the alternative was watching them make decisions that got them killed." He paused. "You are the first person I have encountered in a very long time who is capable of making better decisions for herself than I could make for her. And I don't have a well-developed muscle for trusting that." He looked at the drive in his hand. "But I understand that I need to develop it." It was the most honest thing she'd heard from him. More honest than the apology would have been, because the apology would have been about reassurance, and this was about accurate self-knowledge, which was considerably harder and considerably more useful. "Then we start there," she said. Callum's dress was found 4 days later, not by Ronan's people, not by Drevak's people, who had their own reasons to want him silent. He was found by the federal contact Werner had activated in a motel in Gary, Indiana, where he had been sitting for 72 hours, apparently unable to decide which direction to run next. He was taken into custody quietly, with no public record of the arrest that would surface for several weeks, under the kind of federal arrangement that Werner had spent years making possible. He did not go quietly in the emotional sense. There were things said, apparently about Silas, about the 11 years and the cost of them, and the things Callum had told himself to justify what he'd done. Werner relayed this to Alara in careful summary, without editorial, because Werner communicated the way he did everything, with the specific economy of someone who understood that precision was a form of respect. She told Silas. He listened without interruption. When she finished, he asked one question. Did he say why? At the beginning, why he agreed to work for Drevak. "Money," she said. And then fear. Werner said Callum described it as, once you take the first payment, you're already inside the trap. Everything after that is just the trap getting smaller. Silas nodded. He was quiet for a moment. "I know what that feels like," he said. "The trap getting smaller." She looked at him. "I was 23 when I made the first decision that put me here," he said. "I told myself it was temporary. I told myself I was doing it for specific reasons that would eventually resolve, and then I would step out the other side into something different." He paused. The reasons kept resolving into new reasons. The trap doesn't tell you it's a trap until you've been inside it long enough that the door looks exactly like a wall. She thought about a hospital corridor and a 17-year-old on a gurney and 8 months of legal proceedings that had cost her everything she'd built inside the institution. She thought about the moment she'd looked at the basement space and decided that the space was sufficient, that the institution wasn't the thing anyway, that the work was the thing, and the work could happen anywhere. "My trap looked different from yours," she said, "but I know what it feels like when the door looks like a wall." He looked at her. "Is that why you stayed? After the clinic was destroyed, after all of it, you could have walked. You said yourself you'd managed worse." She considered the question seriously, because he asked it seriously. "Partly it was practical," she said. "I didn't have anywhere to go that was safer than where I was. Partly it was Nico. I couldn't leave a patient I was responsible for." She paused. "And partly it was—" She stopped. She looked at her hands, the surgeon's hands that she'd spent 15 years training and 4 years using in a basement, and that still, despite everything, knew exactly what they were for. "I stopped running from what I was," she said. "That's the closest I can get to it. Everything I did inside that institution, The protocol violations, the transfer block, all of it. I spent 4 years treating it as a failure, as something that destroyed my career, coming into your world, working in that clinic, and then all of this. She gestured at the room, at the city, at the wreckage and the navigation of the past week. It showed me that what I did wasn't a failure. It was just true. It was just who I am. Silas was very quiet. You're the same, she said. You're not what you are because of weakness. You are what you are because something in you refused to accept the alternative. She held his gaze. That doesn't make everything you've done right, but it makes you real. And real is something I can work with. He looked at her for a long time, long enough that the light outside the window shifted slightly, the afternoon moving into the softer angle of early evening. I want to rebuild the clinic, he said. Properly. Not a basement, a facility. He paused. Inside a secure location, with the equipment you actually need, built to your specifications. Complete clinical authority. No storage of operational materials. That ends permanently. A surgical space that is yours and functions the way a surgical space should function. She said, that's the penthouse. Yes. You want to build a trauma center inside your penthouse. I want to build you a trauma center inside my penthouse. He held her gaze. There's a difference. She almost laughed. She almost let it happen. The full, actual laugh, the kind that had been building somewhere behind her sternum for about a week and a half. She held it together, but barely. An MRI machine, she said. He blinked. If I'm specifying requirements, I want an MRI machine. He stared at her. An MRI machine requires significant structural reinforcement, a dedicated power supply, and a shielded room. Yes. She held his gaze. You said built to my specifications. He looked at her for a long moment. Then slowly Silas Moretti smiled. Not the controlled, managed thing she'd occasionally glimpsed at the edges of his expressions. A real one, surprised out of him, arriving before the control mechanisms could intercept it. And it changed his face in a way that she thought he probably wasn't aware of. I'll look into the structural requirements, he said. 3 weeks later, Nico Serene left. He came to the temporary clinic she'd set up in one of the penthouse's spare rooms to get his final wound check. And he was wearing street clothes for the first time since she'd met him, and he had his sister with him, a 14-year-old with the same dark eyes and a backpack, and the watchful quality of someone who had learned early to read rooms. Alara checked his incision and his liver function results, and told him the repair was solid, and he was cleared for normal activity, with restrictions, for the next 6 weeks. He looked at the list of restrictions she'd printed. He looked at her. I'm not coming back, he said. To working for Mr. Moretti. I'm done. She looked at him. He knows, Nico said. I told him 2 days ago. He didn't. He paused, and something moved across his young face that was complicated and real. He said, okay. Just like that. He said, okay. And then he told me he'd make sure I had what I needed to get started somewhere else. He shook his head slightly. I didn't expect that. He surprises people, she said. Yeah. Nico looked at his sister, who was examining a supply cabinet with the focused attention of a 14-year-old who was pretending not to listen. She wants to be a doctor, he said quietly. My sister. She's been saying it since she was 9. Alara looked at the girl. The girl looked back at her with the directness of someone who had given up pretending not to listen. What's your name? Alara said. Cora, the girl said. Cora, how's your biology? Good. Without hesitation, without modesty. Come back when you have your MCAT scores, Alara said. I'll write you a letter. Cora looked at her for a moment. Then she smiled, wide and sudden and entirely unguarded, and looked at her brother with the expression of someone filing information away for future use. Nico shook Alara's hand when he left. It was a formal gesture, a little stiff, the gesture of someone who was 19 and trying to communicate something they didn't have the vocabulary for yet. She shook it without making anything of the awkwardness. She watched them go down the hall and thought about what it cost to keep someone alive and what it was worth, and decided, as she had decided every time she'd considered the question, that the arithmetic always resolved the same way. The night that the federal operation moved on Drivac's network, she was standing at the floor-to-ceiling windows of the penthouse, watching the city the way she sometimes did now, not with the detachment of someone outside it, but with the particular attention of someone who had learned to read it differently. She heard Silas come up behind her. He moved quietly for a large reason she had come to understand. He had learned stillness from necessity, and it had become native. He stood beside her at the window. "Werner's contact confirmed," he said. "Simultaneous operations in 4 jurisdictions. Drevak is in custody. The 3 primary intermediaries have been taken. The trafficking network is frozen at the financial level. They'll spend years unwinding it." He paused. "Werner's exposure is 0, as agreed. Ours is manageable." "And your 2 men?" she said. "The ones you sent back to the clinic?" "Both alive." He said it with a flatness that was not indifference. It was the flatness of relief that has been compressed by someone who has learned not to show relief because it implies the alternative was conceivable. One with a broken hand, one with a concussion, both functional. She looked at the city, the lights of it, all those miles of illuminated human activity, all those people inside their own negotiations with the world. "Your shoulder," she said. "I want to look at it." "It's fine. I'll determine that." She looked at him. He was already turning toward her, already making the small adjustment of someone preparing to allow examination, the capitulation to her clinical authority that had started as friction and had become, somewhere in the past 3 weeks, something that looked a great deal like trust. She examined the wound under the light. The healing was clean, the scar forming properly, the range of motion returning on schedule. She pressed 2 fingers along the posterior capsule, and he held still with the focused containment she'd come to recognize as his specific version of patient. "Good," she said. "Another 2 weeks and you'll have most of the range back. Full recovery in 6 to 8. "Acceptable," he said. She didn't move away from him immediately. She was close enough to feel the warmth of him and the particular quality of his stillness. And the city was enormous and lit behind the glass, and the room was quiet around them. And she thought about basements and paper bags of soup and a 19-year-old's liver and a man who had stood in an alley at midnight with pharmaceutical supplies because someone needed them and he had the means to get them, and that was apparently sufficient reason. "The MRI machine," she said. "The contractor starts next week." He looked at her. "The structural work takes 3 weeks. The shielding takes 2 more. You'll have a functional facility in approximately 6 weeks. She looked at him. "You're actually doing it." "You specified it." "I said it to see what you'd do." "I know." Something in his expression shifted, very slightly. The faint trace of the smile she'd seen once, the real one, not managed at all. "I did it anyway." She looked at his face. She thought about what Ronan had said in the kitchen and what she'd said in the car, and what was true, regardless of either of those things. The thing that had been true since the night he stood in her destroyed clinic with a sutured shoulder and 12 hours of compound disaster behind him, and looked at her with no controlled variables left and nowhere left to hide. "Silas," she said. "Yes." "Stop being careful." He looked at her. The question in his eyes was real, not performed, not managed, entirely actual, because Silas Moretti was a man who had learned to be careful about everything, and she was asking him to stop, right here, at the window, with Chicago spread out behind the glass like an argument for the persistence of human effort. He reached out with his right hand and touched her face. Just the side of it, just his fingers against her jaw, with the particular precision of someone who has learned not to move unless they intend the movement. She held still. Outside, the city kept going, indifferent, enormous, lit from the inside against the dark. Below them, in the building that now held the beginning of a proper surgical facility, the work of survival continued in the way it always continued, stubbornly, incrementally, without any guarantee of completion. She was not the ghost surgeon anymore. She was not hiding beneath Chicago, treating patients from the shadows of a life she'd told herself was adequate. She was standing at the top of a world she hadn't chosen, and had chosen anyway, and her hands were steady, and the man beside her was real in the way that mattered, imperfect and known and present. The empire still belonged to Silas Moretti, but its heart, and the hands capable of repairing everything violence destroys, belonged to Alara Voss. And that, in the end, was the only architecture that held.